So this is my capstone portfolio. I'm Macy. The public issue that I decided to research was depression in older adults. And I chose this issue because it is something that is growing due to the growing older population. There's a lot of contributing factors, one of them being chronic illnesses and also loneliness and isolation. And around 11% of Nebraska's older adult population is depressed already. And with the population growing and that age of the population growing, the issue is only going to get worse. And more people are going to be diagnosed with depression. And I chose to research this issue because I appreciate the older population. I want them to have the care and support that they deserve as they age. And I feel that mental health is something that can get overlooked, especially in older adults with many chronic illnesses. They might be isolated from others and it might not get recognized. And I do have a personal connection to this issue, specifically with mental health. I recognize that a lot of the patients that I care for every day are older, and a lot of them don't have a great support system or family to care for them, and I want to make sure that I am there to care for them holistically by addressing their mental health needs as well as their physical needs. So for my first effective communicator, this experience was at work. I was dealing with a particularly difficult coworker, a nurse. She was giving me a hard time. She repeatedly put me and the other CNAs down. She wouldn't include me in patient care. She never trusted me with patient care tasks. And she also made me feel that the work that I was doing as a CNA was not important. And from this experience, I learned that my strengths in communication are my body language and my tone and my listening skills. I ended up bringing this up to management, and that's kind of where I was able to see some of my communication strengths. And while I excel in these areas, the experience taught me that I need to work on thinking before I speak, or before I act. And when having tough conversations, I would often speak too quickly because of anxiety. And now, after this experience, I have learned how to best phrase what I'm going to say and take my time when communicating in situations like this one, because it's important how you carry yourself and how you talk in those situations. I can use this experience with my public issue of depression in older adults. The insights that I gained about being an effective communicator are important when I would bring this up to higher levels. It's important to stay calm and explain how depression affects this specific age group and why it's important to address in comparison to just mental health access overall. I think this population is one that often gets overlooked, and so definitely how I carry myself in those types of conversations would have an impact on this issue. My second effective communicator, my experience that I had was during clinicals. I had an ICU patient that did not want me as a student. They expressed that they didn't want me involved in their care because I was a student. The day was going pretty well for me, and I was doing all the tasks that I could as a student under the supervision of my nurse that I was assigned to. Later on in the day, the patient became agitated and told me that I needed to explain what I was doing before I did it because I was a student and she didn't trust me, which is understandable. After this, she told the nurse that she no longer wanted me in the room and she didn't want me to do any of her tasks, her patient care tasks. And I didn't make any mistakes with this patient, so I was confused why this was something that was happening to me. I felt confident in the skills that I was performing, and the nurse did talk to the patient and explained that I was perfectly capable of performing the tasks that I was doing, and she was watching me the whole time. And I did end up having a conversation with this patient about her feelings towards me, and found out that she was anxious just because I was a student. She didn't mean to come across as mean to me. It was, her care in my hands, and she wanted to feel that she had somebody competent taking care of her. And she didn't feel that that was me because of my student role. After this, she let me continue with her care, and I explained things a little bit better as I was doing them. So I learned from this experience that staying calm and being understanding when communicating with patients makes a world of a difference. I was able to show her that I cared about her by having a conversation with her at her level, sitting down, maintaining eye contact, and showing her that I truly cared about her. And after this conversation, the rest of her care went smoothly. So I learned the importance of how my body language can affect someone's perception of me. And I can use this experience also to deal with the issue of depression in older adults in Nebraska. I can use this when advocating for older adults with depression. Conversations about mental health can be difficult, and I think it's important to show the patient that I care about them and their well-being, and I'm not just there because I have to be. And now on to my reflective individual experience number 1. So in this specific instance, I was at work and I was working in pre-op. I had a transgender patient, and I had never had a transgender patient before. I thought that I dealt with the individual very well for never having experienced that before. Just with certain tasks that I have to perform in pre-op. I referred to them by their name that they went by and their pronouns that they preferred. But I was conflicted when it came to time to get a urine pregnancy test for this patient. The patient identified as male, but I was told that I still needed a urine sample because they were born female. And so, I asked the nurses, and they didn't know what the guidelines in place for the situation were. And I ended up not getting a sample because I was uncomfortable asking the patient about it, and no one that I talked to really seemed to think that it was something that was necessary. So I learned a lot from this experience. It allowed me to critically think about my actions and interactions with this patient. I never want to forgo patient care because I'm uncomfortable. And although my interactions with this patient were professional and went smoothly, I allowed my personal feelings to interfere with patient care. I didn't want to ask them personal level questions just because this was when I was a newer CNA and I had never dealt with this type of situation before. I did allow my personal feelings to interact with patient care, and I learned how important it is to advocate for my patients. The nurses in this situation, their initial reactions to the patient were negative. They kind of just said, oh, well, whatever, we don't need to get a urine sample, it's fine. And I recognized that there were guidelines put in place, but nobody knew where to find them or what they were. And so I recognized that personal feelings need to be put aside in order to provide good care for every patient. And I can also use this experience as a reflective individual to potentially address the public issue of depression in adults. I can use my trait of my ongoing personal assessments and to evaluate if I'm meeting the unique needs of each patient that I care for. Each patient will have their own mental health concerns, and their care should be tailored to their specific needs regarding activities, support, socialization, spiritual care. By evaluating myself, I can ensure that I am caring for each patient and their mental health equitably, and not allowing myself to get in the way of anybody's care. As for my second experience, I was in my clinical rotation, one of them at Methodist. I encountered a patient that spoke little English. He was scheduled for surgery, and he did not have a translator with him. He was a very young patient, had nobody with him. A MARDI was used to translate for him in pre-op, but when the surgeon arrived, he turned off the MARDI. I don't know if he didn't realize what it was, because no one was talking at the time. He started to talk to the patient. The patient was confused. He didn't understand what was being said to him. He was taken to surgery, and when in the OR, he looked terrified. They put him to sleep, went through with the surgery. After the surgery, the nurse didn't use the MARDI to translate for the patient. And this was something that really made me upset. Because I think that interpreters are necessary, one, to provide informed consent for each patient, and also just the level of comfort that the patient was given was none. And so I really felt for this patient, and I wish their experience had been better, and I wish that my experience in that situation would have been better. I learned a lot from this experience, however, though. I learned that advocating for our patients is one of the most important things that we can do as a nurse. Our patients are trusting us with their care, even when they're asleep. And I learned the importance of analyzing situations such as this one to see what can improve, which is what I did in this scenario. I recognized that the patient was young, Hispanic, and non-English speaking. I also found out that one of his nurses involved in his care was experiencing burnout, which is no excuse for poor patient care, but that did contribute to her actions. And I reflected and realized that these are no excuses for improper patient care. So from this experience, I can potentially address the issue of depression in older adults. I can use this to advocate for better access to care for older adults with depression, just like with this patient, advocating for non-English speaking patients to have access to equitable care and have a translator present at all times. I can do the same thing with depression in older adults, by advocating for them. And that's what should have been done for this patient. And I can advocate by the older adult population by bringing the issue to local office and recommending initiatives and bills to improve mental health care access for the older adult population. Specifically, maybe increasing telehealth access, or having someone to train older adults, having classes for how to use technology and telehealth. That way we can improve access to care for this population. Now on to my change agent experiences. In this experience, I was at clinical. We were doing health screenings at a homeless shelter. We were helping to identify needs in the community. We were making referrals, making appointments, providing education, providing health screenings like blood sugar checks, A1Cs, blood pressure, just simple kind of tests that this population may not have access to on a regular basis. So my clinical group and I were doing these screenings, and with this, I was able to identify their health needs and risks, provide education, and I helped also coordinate transportation to and from some of these appointments for these people. From this experience, I learned a lot about being a change agent. I learned about being able to recognize gaps in healthcare, especially for vulnerable populations like the homeless. And I learned how important it is to advocate for people who can't advocate for themselves. I also learned the importance of providing equitable care and equitable access to care, because each patient has their own unique challenges and circumstances that could prohibit them from receiving good care. My insights about being a change agent from this experience could help me address the issue of depression in older adults, because it would help me be able to identify a need for change. Symptoms of depression in older adults may get overlooked due to their symptoms maybe being attributed to their age or another chronic illness. As a change agent, I could bring this issue into the spotlight in my community and advocate for depression screenings and raise awareness on this issue. For my second topic, for change agent, this experience, I had another Spanish-speaking patient, this time at work. They came in for surgery, and I assisted with his pre-op care. I found difficulty when I was trying to explain to him how to get dressed for surgery. And although an interpreter was scheduled, they were late. Despite the language barrier, I tried to explain to the patient how to get changed. I used mainly nonverbal communication skills, kind of just different hand gestures and pointing. I was able to get him checked in and ready, but the interaction caused kind of a delay. Things were taking a lot longer, and I was able to recognize a need for the improvement in these situations. Kind of recognize, like, what do we do if there is no interpreter? And this also taught me a lot about being a change agent. I learned that being a change agent means advocating for our patients, and I also learned how important communication is in the nursing world. I learned that providing culturally competent care allows for mutual respect between each patient and the healthcare team, and I was able to recognize that language barriers can lead to health disparities, and I recognized a need for change in this area. This experience will also help me address depression in older adults, because I identified that language barriers can lead to health disparities and that communication plays a big role in providing competent care for each patient. I can use this to advocate for better resources for patients that require interpreters, because there are older adults who require interpreter use, and they deserve to have that equitable care as the rest of the population. I can advocate for better resources and access to care for older adults, such as access to interpreters when needed and improved screening techniques. So, in conclusion, the public issue of depression in older adults in Nebraska may seem small. However, this population is growing, and that means the issue is growing. They're going to need competent and caring nurses to help them, and I can help address this issue through advocacy, education, and reflection. Thank you. And here are my references.